afternoon, everyone. Good afternoon, everyone. I'm Dr. Pranathi, Senior Consultant, Head of the Department of Ophthalmology, KIMS Secunderabad. Today, our topic of discussion is glaucoma. Next slide, please. What is glaucoma? Glaucoma is a blinding disorder which is characterized by irreversible optic neuropathy causing diminished field of vision initially and finally leading to blindness. Next slide, please. In world, around 78 million population are affected with glaucoma, which means every one patient, one person in 200 people above the age of 40 are affected with glaucoma, and it comes to around 1 in 8 in people above 80 years of age. Coming to disease burden in India, around 1 crore 20 lakhs people are affected with glaucoma. Out of them, around 1 lakh people are already completely blind. It is estimated that more than 90% of these people are not yet registered. Next slide, please. There are different classifications of glaucoma. Coming to the simpler traditional classification, we classify glaucoma depending upon the etiology as primary and secondary, and depending upon the anatomy of the anterior chamber angle as open angle and closed angle glaucoma, and depending upon the age of onset, we classify it as congenital or infantile, juvenile glaucoma, and adult onset glaucoma. Next slide, please. Coming to the congenital glaucoma. As you are seeing in this picture, it's a newborn baby who is affected with the glaucoma, or they may develop within 1 year of the age. And we are seeing these cases more in India compared to the Western population. Around 1 in every 3,000 live birth cases, we are seeing this glaucoma, whereas in Western countries, around 1 in 10,000 population are affected, which means the incidence of congenital glaucoma is very high in India. This is mainly because there is high incidence of consanguineous marriages. So the kids which are born in those consanguineous marriages, they're highly affected with glaucoma. And this congenital glaucoma is a very serious blinding disorder, because the kids who are born with the congenital glaucoma, if not treated immediately, will grow blind. Eyes properly to the light, and they'll have severe watering and severe photosensitivity, means they cannot see the light properly. So, and the eye in this picture, you can see that it's a white, cloudy, large cornea. So any child who is born with these symptoms should be immediately referred to the ophthalmologist for further management, as congenital glaucoma doesn't respond to the drops. It requires immediate surgery. But most of the patients in our rural India, because of lack of awareness, the children are brought to the eye hospitals at a later stage. So it is a very devastating condition that can turn the child blind. So any child who is born with any eye symptoms, not just the symptoms which I mentioned, any eye symptoms like redness, watering, or any child not able to follow the light, should be immediately taken to the eye doctor for further evaluation. Next slide, please. This is next is juvenile glaucoma. Juvenile glaucoma is the glaucoma which we see in the population in the people who are aged between 3 to 40 years of age. And the juvenile glaucoma is also a rapidly progressive condition. Means these patients who are with a juvenile glaucoma, they present with a very high intraocular pressures and highly fluctuating intraocular pressures. So the prevalence rate of juvenile glaucoma is around 0.38 to 2 in 1 lakh individuals. In around 30% of these juvenile glaucoma patients, we are seeing mutation of the mycilin gene. The most of the presenting features of the juvenile glaucoma or headache, and they may not be able to see the things clearly. These patients are also presenting very late to us because the initial stages, they will not have any symptoms until the pressure is very high, more than 40 millimeters of mercury. And juvenile glaucoma patients also, they don't respond properly to the medical line of management. Even they require surgery as a mainstay of the treatment. Next slide, please. Next is the adult onset glaucoma. Adult onset glaucoma we mainly classify as primary and secondary glaucoma. Primary glaucoma is further classified as open angle and angle closure glaucoma depending upon the anatomy of the angle of the anterior chamber. Secondary glaucomas means those glaucomas which we see in a patient who has pre-existing any eye problem. Next slide, please. Before I go into details of open and narrow angle glaucoma, I'll first explain you the basic anatomy of the eye, which will help you to understand what is a narrow angle and open angle. As in this picture, you can see that there is a anteriormost layer of the eye. It is cornea, which we can see in the cross-sectional view. And behind the cornea is a brown color tissue, which is iris. The place where this cornea meets the iris tissue is called the angle of the anterior chamber. Means anterior chamber is the place between the iris and the cornea. In the iris tissue, you can see a central gap, which is seen like a jet black color in the picture, which is called pupil, which is around 3 to 4 millimeters in size. And behind the pupil, you can see a transparent structure called lens. And the light rays which enter the eye pass through the cornea, lens, and finally reach the retina, which is the innermost layer of the eye. From the retina, the signals are then transmitted to the brain through the optic nerve, which you can see in the picture. Next slide, please. Now coming to the open and angle closure glaucomas. As you can see in this picture, the space between the iris and cornea, which is called the anterior chamber, is filled with the aqueous humor. Aqueous humor is the fluid which is produced by the ciliary body, which flows through the posterior chamber and enters the anterior chamber through the pupil. And from the anterior chamber, it drains into the angles of the anterior chamber and then enters the trabecular meshwork. From there, it goes into the Schlemm's canal and finally get absorbed through the episcleral veins. In the first picture, where you can see as an open angle glaucoma, you can see the space between the cornea and the iris tissue, that angle is wide open. So we label it as open angle glaucoma. Here, the pathology lies mostly in the trabecular meshwork, means there is resistance for the outflow of the aqueous humor in the trabecular meshwork. Next is the angle closure glaucoma. Angle closure glaucoma, where you can see in the picture that the space between the iris and the cornea, that angle of the anterior chamber, is very narrow. So the fluid, that is the aqueous humor, gets accumulated in the anterior chamber, causing rise in the intraocular pressure. So the mechanism is different in both the types of glaucoma. So the mainstay of the treatment also differs. Next slide, please. So first coming into primary open angle glaucoma. The major risk factors for the primary open angle glaucoma is rise in the intraocular pressure. The normal intraocular pressure of the eye, which is supposed to be 20 millimeters of mercury, if it is more than 20 millimeters of the mercury, then we consider it as ocular hypertension. So ocular hypertension is a major risk factor for a patient to develop primary open angle glaucoma. Next is the increasing age. When we see patient prevalence rate as around 2% in the patients more than 40 years of age, at the same time, we are seeing a prevalence rate of about 10% in patients who are aged more than 80 years of the age. So as the age advances, the patient is at high risk of developing the primary open angle glaucoma. Next is the family history of glaucoma. So in case if the patient's siblings or mother, father, or any first degree relatives are affected with glaucoma, then this patient is also at high risk of developing glaucoma. Next is the myopia. Myopia means it's the minus number, means the thick glasses which the patients wear to see the distance clearly. So all those patients who have pathological myopia, means if they have a power of more than -5 diopters, they are also at risk of developing this primary open angle glaucoma. Next is the systemic diseases. All those patients who have a systemic risk factors like hypertension, diabetes, cardiovascular diseases, they are also at risk of developing this glaucoma. And the last one is the corticosteroid responsiveness, which means any patient who takes steroids either in the form of inhalers or in the form of tablets or any other form like creams, they are at risk of developing rise in the intraocular pressure. So we call them as steroid responders. Means these patients over a period of time, their intraocular pressure increases and causes glaucomatous optic disc damage. Next slide, please. As you can see in the picture, initially the patients who have this open angle glaucoma, they'll not have any symptoms. But later, as the pressure builds up and their optic nerve gets damaged, as seen in the picture, the peripheral field of vision first decreases. And if the patient leaves it unattended, then gradually his central vision also gets affected and he may become blind. Next slide, please. Next slide. Yeah. Next comes to the primary angle closure glaucoma. In a primary angle closure glaucoma, the main risk factors are hypermetropia. Means as I told for the open angle glaucoma, high minus number. In angle closure glaucoma, it is mainly high plus number. Means all those patients who have high plus numbers like more than +3 diopters, they are at risk of developing this angle closure glaucoma. And narrow angles of the anterior chamber. Means where there is the aqueous outflow, there is resistance to the aqueous outflow at the angles of the anterior chamber. These patients are at risk of developing angle closure glaucoma and plateau iris configuration. Next slide, please. Coming to the symptoms of the primary angle closure glaucoma. Most of the patients of primary angle closure glaucoma, just like the open angle glaucoma, they may be asymptomatic. Or if they are getting any subacute attacks, they may feel intermittent eye pain, which is associated with a headache, and they may feel redness in the eye and watering of the eye. Especially, it will be all will be the intermittent attacks. Usually, they develop these symptoms whenever they go into the dark room, because as they enter the dark room, like cinema theaters and all, the pupil will dilate. So there will be buildup of the pressure. So they start seeing the colored halos and they develop the intermittent blurring of the vision associated with the headache and brow ache. And once they come back to the normal lighting conditions, usually their symptoms subside. Next slide, please. This is the picture of an acute angle closure glaucoma. As I told you, most of the patients with subacute attacks, they'll have intermittent symptoms. But when this patient doesn't reach out to the doctor on time, then the angle gets closed and they develop acute angle closure glaucoma. Acute angle closure glaucoma is a very sight-threatening disease and it is an emergency ocular condition. In this condition, the patient's intraocular pressure usually shoots up more than 40 millimeters of mercury. So they will develop very severe eye pain associated with headache and vomiting. Even you can see the eye will become very red and they cannot see the things clearly. And usually most of these patients, they land up with the emergency departments thinking it's a neurological problem because they have more of headache and vomiting. But it is mainly because of the rise in intraocular pressure, they are developing all these symptoms. This is an emergency condition for which immediately we have to address the patient by giving some intravenous hyperosmotic agents like mannitol to decrease the intraocular pressure. Otherwise, the patient may go into blindness. Next slide, please. Next is secondary glaucoma. Secondary glaucomas, as I told you, are those glaucomas which develop in those patients who have a pre-existing eye disease. Means they may have any eye problem before for which they would have taken treatment, and following any complications of the eye surgeries like keratoplasty or any retinal surgeries, or if they had any eye infection like herpes zoster ophthalmicus, during which they have developed the inflammation in the eye that has caused rise in intraocular pressure. That is also leads to secondary glaucoma. And as you can see in the picture, it is a picture of the traumatic glaucoma, where the patient had an injury with a cricket ball, causing there you can see that there is a blood in the anterior chamber of the eye. So the pressure builds up in the eye, causing secondary glaucoma. Most of the patients with the trauma, they may present with the traumatic glaucoma in the acute, as soon as they develop injury, or they may have a late presentation. Late presentation is called angle recession glaucoma, where there is damage at the angles of the anterior chamber of the eye. And other causes may be any previous ocular surgeries causing complications, especially retinal surgeries, are most of the causes which we see in India for secondary glaucoma are lens-induced glaucomas. Lens-induced glaucomas means most of the time, especially I've seen many such lens-induced glaucomas in the COVID period. Because patients consider cataract surgery as an elective surgery, they have been postponing their cataract surgery. So the cataract which was immature, once it becomes hypermature cataract, then it starts causing increase in the intraocular pressure in the eye. So we call them as lens-induced glaucomas. Even lens-induced glaucomas are an emergency conditions because immediately if these lens-induced glaucomas are not dealt with the cataract surgery, even these patients may turn blind. Next slide, please. So, till now I've explained you what are all the risk factors for developing glaucoma and who all can develop glaucoma. So, finally, I will tell you in short who are at risk for glaucoma, or who has to go to the eye doctor for getting their eyes checked to screen for the glaucoma. First is any patient who is above the age of 40 years, I would recommend a comprehensive eye examination. Comprehensive eye examination means not just getting their glasses checked. Most of the patients above the age of 40 years, they start developing difficulty in the near vision. So they usually go to the optical shops and take the reading glasses. But that is not at all recommended because these blinding conditions like glaucoma or diabetic retinopathy, they get missed out in the early stages. So all those patients who are above the age of 40 years, they should reach out to an eye hospital for the proper comprehensive eye examination. And all those patients who have the family history of glaucoma. Most of the times, just because of their lack of awareness, the patients are themselves are not knowing that their grandparents or their parents had glaucoma. So any person who is having glaucoma, they should inform their siblings and as well as their kids that he has glaucoma, so that if the next generation, if they go to the eye checkup, if they inform the eye doctor that there is a family history of glaucoma, certain tests will be undertaken to diagnose glaucoma at an early stage. Next is the systemic risk factors. This diabetes, hypertension, as well as cardiovascular diseases, all those are all risk factors for the patient to develop glaucoma. So even these patients, like diabetics or hypertensive patients, as routinely how they go to the physician to get the regular blood pressure and even blood sugars checkup, they should visit to an eye doctor every 6 months once for the complete eye examination. Next is the patients who have high minus power or high plus numbers, like high myopia or high hypermetropia. Even these patients, they just go to the optical shops and then they go for the change of their glasses or the contact lenses. But that is not at all recommended, because those patients who have high plus number or high minus number, they are at high risk of developing the glaucoma when compared to the general population. And even those patients who had any previous eye surgeries, usually they go to the eye doctor for one annual checkup after the eye surgery, and they're usually lost to the follow-up. Especially those patients who had any keratoplasty, means corneal transplant surgeries or retina surgeries, they should be in touch with the eye doctor at least yearly once for their lifetime. Next is the steroid responders. Like as I told you, these steroids, immediately they may not show any rise in the intraocular pressure of the eye. But over a period of time, If they're taking the steroids for either the rheumatology problem or for their bronchial asthma or for any other disease, immediately the patient will not develop any symptoms. But over a period of time, they start experiencing the eye symptoms. So it's better whoever patient is taking any steroids in any oral form or inhalation form, they should be in touch with the eye specialist for the regular intraocular pressure measurements. Next slide, please. Coming to the diagnosis of glaucoma. These patients who have been having these risk factors, once they reach out to the eye doctor for the glaucoma screening, there will be certain tests which will be done addition to the basic eye examination. Means usually the basic eye examination involves refraction and color vision testing. In a glaucoma screening, we do additional tests. Next slide, please. It's shown in the figure, the first test is a applanation tonometry. Applanation tonometry is a test which we use to detect the intraocular pressure, means to measure the intraocular pressure. Just like the BP apparatus, this machine is meant to check the intraocular pressure of the eye. Based upon the intraocular pressure of the eye, if we see that there is rise in the intraocular pressure, then we advise further tests to confirm the diagnosis of glaucoma. The next picture is the gonioscopy. As I had explained to you earlier, narrow angles, open angles and all that to come to the diagnosis of whether it's an open angle glaucoma or narrow angle glaucoma, the ophthalmologist will do the gonioscopy. Gonioscopy is also a procedure where it is a painless procedure where the ophthalmologist will put a drop of anesthetic drop in the eye and then examine the eye with the help of a gonio lens. Next slide, please. This is the fundoscopy test, as I was mentioning you. In the earlier figure, I told you that the signals, whatever the retina has to transmit, will reach the brain through the optic nerve. Eye is such a wonderful organ that where we can see a part of the central nervous system. Means there are 12 cranial nerves in the body, but out of which only optic nerve is the only nerve which is visible, and that too which we can see through the eye. In the figure, what we are seeing, first one is a healthy optic nerve. The healthy optic nerve will have a pink neural tissue with the central paler area which is called optic disc cup. The picture adjacent to that, you can see that the pink tissue, which is a healthy neuroretinal rim, it is damaged and the cup ratio means the cupping of the optic disc has increased. This test is also a part of the eye examination test. Next slide, please. Based upon the above test, once your doctor confirms that you have an open angle glaucoma or narrow angle glaucoma, then further test will be advised to you. And among the further tests, this OCT RNFL test is the first test. OCT test is also a simple scan. It is a non-invasive test where whatever I had explained to you earlier, this optic disc cupping and all, that will be measured by the machine. What is the cup disc ratio, and even the retinal nerve fiber layer thickness also will be measured. Next slide, please. This is a visual field test. As I shown you in the earlier figure of primary open angle glaucoma, that initially the field of vision of the patient will be decreased and finally the central field will be affected. In this figure, you can see in the first figure, it is a normal visual field of a patient. Once the patient developed glaucoma, early glaucoma, he starts seeing scotomas in the field of vision. Scotomas means in those areas the patient cannot identify any objects. As the disease becomes moderate, his field of vision gets affected more. In the next figure, you can see that there is superior field of vision is totally affected. And if it is further unattended, you'll develop biarcuate scotoma. Means the field of vision is totally affected, means there is peripheral constriction of the visual field, and finally only the tunnel vision is left. Means only the central vision will be there. He can't see anything in the periphery. And if the patient is not attended even in this stage, then he may become totally blind. Most of the patients come to us in the moderate stage. They don't even come to us in the mild stage. They come to us in the moderate stage saying that whenever they are driving or whenever they are walking, they are not able to see the sights. And most of these patients being aged, they think whatever the eye problem they get, they assume it to be the cataract. Especially I've seen more number of cases in the COVID period because they've been postponing their eye appointments thinking it's a cataract which is causing the eye problem, and they've come to us in an advanced stage. So any patient who has any eye problem, especially in the field of vision, they should reach out to the eye doctor for all these tests. And all these tests, OCT, visual field test, gonioscopy test, all these tests doesn't take long time, and they're available in all the hospitals, eye hospitals, so that the diagnosis of the glaucoma can be made in the early stage and treatment can be given. Next slide, please. Once we come to the conclusion of the diagnosis of either open angle glaucoma or angle closure glaucoma, then comes the treatment. The treatment of the glaucoma mainly depends upon what is the cause. As I told you, it is an open angle glaucoma. Then the angles being in the open stage, then the doctor will first advise you some eye drops to decrease the intraocular pressure of the eye. And if the intraocular pressure of the eye is not getting controlled with the drops, only then the surgery will be advised. But whereas in a narrow angle glaucoma, because the pathology lies in the angles of the eye, it has to be corrected with the lasers. So immediately the doctor will advise you to undergo for laser iridotomy, which is also a simple day care procedure, and it is not very costly procedure, which will be finished in the daycare process, and then the patient will be discharged soon. And after the laser iridotomy, the patient will be advised to use some drops and advise regular follow-ups. Most of the patients, once we advise that they require some laser procedures, they immediately get afraid that there is some major thing is going to happen in their eye. What I tell to these patients is you can go for a second opinion whether you should undergo laser or not, but don't neglect whatever the advice given by the doctor. Because as I've shown you in the earlier pictures, initially you will not find any symptoms even if you have glaucoma. And the worst part about glaucoma is once the visual field, whatever is lost, it is lost. It will not be regained back even if you undergo any lasers or you start putting drops at the stage. And most of the patients, if they come on time to the doctor, it will be addressed by simple drops and simple lasers. Surgery is usually reserved for those cases where it is in a very advanced stage or if the pressures are not getting controlled with just drops or lasers. And one more drawback what we are facing in managing this glaucoma patients is non-adherence to the treatment. Most of the patients initially, once we say that you have some glaucoma, you have to start taking some eye drops and all, they will start taking those drops. I mean, they start putting regularly for a period of 3 or 4 months, and then they start neglecting. Once they come back to the follow-up to us in advanced stage, when we question them, they say that we didn't find any difference even after starting the medication. So we are not using regularly. What I want to convey through this program is whatever field lost is lost. Whatever the medication the doctor is advising you to start upon is mainly to prevent further progression of the disease. So if you are not using the drops regularly, if you are not following your doctor appointments properly, then you are losing your eyesight without your knowledge. World Glaucoma Week is celebrated every year in the month of March between 6th to 12th. So, as a part of this program, we could do many awareness programs and even eye camps to create awareness among the public so that they come to the doctor for early diagnosis and further treatment. I hope I've given the necessary information required for the early diagnosis and who has to meet the doctor for the early checkups and treatment. If you have any queries, do contact me. Thank you.